Hi, my name is Suzanne, and I am here as a patient of Dr. Virginia von Schaefer's. A little bit of the backstory is I fell in December of 2022, and in the process, and hurt my back, my side, and in the process of getting that diagnosed, I had a CT scan. And while they found nothing in terms of broken bones or fractures, the doctor did say that he saw something on my vena cava that looked like a hematoma and that I should have it checked. I really ignored that at the time because I was in such pain with my back. However, by January or February, I went to a primary care doctor, and she was very concerned about that and sent me to an oncologist, a gynecologist-oncologist in Palm Desert, California at Eisenhower, at Lucy Kersey. There I had many more tests, and it was clear that it was very suspicious, and they assumed that I had cancer, and they found not only the original mass, which was small, but they found a second one on the vena cava. So I continued to see that doctor at Lucy Kersey, and it just dragged on and on and on, and he was going to do a hysterectomy, and I just didn't like the whole operation. So I moved to City of Hope, where I found a wonderful doctor, and on April 26th, I had a full hysterectomy. Although she could not get the exterior husk off of the vena cava completely, so that was left, which was of concern to me because they certainly diagnosed both of those tumors as being stage 3A, I believe it was. At that point, my partner went to another doctor, and she, in our discussion with her, she told me that she had had cancer for 15 years and had managed to stay ahead of it because she was working with a gynecologist-oncologist, an integrative medicine oncologist. And she had had various kinds of treatments, almost all alternative, and that she was 15 years away from the original diagnosis of her cancer. And that fascinated me, and I'd never heard of integrative oncology, and was interested in pursuing that. And it was she who told me about Dr. Virginia von Schaefer. And on the 31st of April, I had my first consultation with her here in San Clemente, and that is how I got to her. I mean, I didn't need any amount of time really to know, both from the moment I entered the office, which had, at the risk of sounding crazy, it had great energy, and she had great energy, and I just intuitively knew from within the first 5 minutes that I wanted to work with her. It was very clear. Not only did she have this razor-sharp intellect, could answer all the questions, and believe me, I sent every test I'd taken. I think I had to upload 50 documents that I sent to her, and my partner wrote a biography of my life and the kinds of things I had done and who I was. And she had, she had read it all and knew my history so that she could really speak to me authoritatively, and explained that she thought she could treat me and that we would be successful. Of course, no one's a god, no one has a crystal ball, but I knew from her education, which I had read about, and from the way she spoke, that I was in the right place, and that it was really fortuitous. You know, all of those things that happened, from the fall to the CT scan, to the CT scan, to meeting the other doctor, to being told about Virginia von Schaefer. All those things had fallen into place over just a matter of 2 or 3 months. So by the time we left the doctor's office here in San Clemente, there was no question what we were doing. It was a done deal. So I knew, and I knew that not only was she a great doctor with a variety of experiences, but that she thought outside of the box, and she worked outside of the box, so that she would mix sort of traditional medicine like chemotherapy, but in low doses. She would get every test available anywhere in the world to be able to know how to treat this cancer. And that she was a really warm human being, which was very important to me. You know, there's none of this clinical distance that says, you know, we can't go there, we can't go there. I mean, she was just wonderful from the beginning. And I can't imagine that anyone coming here wouldn't feel the same way, that you're in safe hands. Well, actually, things have been going very well. I learned, which I did not know, that chemotherapy sort of knocks your immune system down and, you know, just creates, you know, weakens you. You know, there were times when I was low on energy. I mean, frankly, the chemotherapy was not bad. I mean, a few things. I lost my taste buds, but once I was through my 8 treatments of low chemotherapy, within 2 weeks, my taste buds were back. My energy was back. It came back, you know, fairly rapidly, actually. So today I feel great. We're going to do one. The last PET scan I had 4 months ago was clean. So that means that the first phase of the treatment with the chemotherapy was totally successful in knocking out any remnants of cancer that we knew were there. And we're waiting for another PET scan, which I'll have in another week, actually a week from today. And we're waiting for my immune test to come back from abroad to see if my immune system is upregulated. And then assuming that it is, we can move into the last phase with the dendritic vaccine, which I am very eager to do. So in the meantime, I'm continuing to treat my immune system, treat any cancer cells that might be flowing around in my blood and in my body. I'm treating my the viruses, and what's the other one? Inflammation. So those things are being treated 3 days a week, and I'll get the PET scan, and then we'll get the immune system test back from abroad, and we'll know more. And I'm very hopeful and feeling positive that those will come back in the clean and upregulated. So I'm very happy with my treatment. I wish it were all over, as I'm sure every patient does, but it's a pleasure to come here. It's a pleasure to see Dr. von Schaefer. She goes around and visits patients so that you always feel like you're in touch with her, which is very different from any other doctor anywhere. The head nurse and the 2 assistants are wonderful and upbeat, and everyone is very compassionate. It's just a really upbeat, happy, fun environment, even if that sounds a little crazy. It's the truth. So I'm very pleased. I'm very pleased. Anyone who is on the website and sees any of these testimonials, I would suggest that before you make any decisions about surgery or chemotherapy, that you make an appointment with Dr. von Schaefer and have a consultation, whether it's in person or on Skype or FaceTime, whatever it would be. And send to her all the information you possibly can and see what you think about the concept of integrative oncology and how you feel about her, which I can't imagine you not being, you know, completely on board once you meet her. And the other thing is, if you would feel safer checking out a standard oncologist, go ahead and do that. But I wouldn't make any decisions until you had talked to Virginia von Schaefer, period. And I would recommend you go online and you read about what integrative oncology is and familiarize yourself with it. It's a lot of information, and as I said, I knew nothing about it until I met that doctor who recommended Dr. von Schaefer. So don't get standard chemo, don't get surgery, don't do anything until you've been to her. That's my advice.